As a birth doula, I have attended quite a few births actually where the baby had a bowel movement in the womb. And this can sound really scary to parents, but in all of the situations I've been at, it's actually turned out fine. So typically, how we know that a baby had a bowel movement is that the mom has some discharge that is maybe a little bit like yellow, greenish sometimes. It usually has a distinctly different color than, the discharge that you typically have during birth. During birth, it's pretty common to see some blood, some more clear discharge, maybe with a little bit of brown, like some old blood, some pink. But the meconium, that's what we call the baby's first bowel movement. It's usually, again, like a yellow, a green. It's discolored, and usually, sometimes this will show if it happened right around the time where a mom's water breaks, the water comes out and the water's discolored. That's a way that we know that the baby probably had a bowel movement. I've been at births where the water's already broken and then the baby likely had a bowel movement after that. And when the mom was pushing, some of the meconium was coming out. In the situations that I have been in, it was not the meconium being expressed, us seeing the meconium. The doctors did not think it was reason to do a C-section. They just, wanted to make sure that when the baby came out, that they were taken care of. I think in a lot of these births, they did a little bit more monitoring for the baby just to make sure baby's heart rate was good. And if you are at a hospital, if you're birthing at a hospital and we have seen meconium before the baby comes out, the NICU team will be in the room when the baby is born. And the NICU, it stands for Neonatal Intensive Care Unit. So there's a team from the NICU that will be there. And typically, right after baby's born, they'll clamp and cut the cord and they'll bring baby to the warming table and they'll make sure that the baby did not aspirate or breathe in any of that meconium. Because if that happened, it can make it a little bit trickier for baby to take those first breaths. Sometimes it sounds like a little bit gurgly. It can also lead to an infection, getting that meconium, in the lungs. Which I've seen in one situation. There was an infection, but the baby had antibiotics and the baby was completely fine. So I say all of this so you know that if baby has that bowel movement in the womb, there are ways that they manage it, and it does not necessarily mean that you need to get a C-section. But if you're curious about this, I really recommend you talk to your care provider more about it and ask them how they typically deal with it. Let them know, what would you do if, my baby had a bowel movement when they were still inside of me? Like, let's talk it through and make a plan, because a lot of times making a plan about something, especially if it's something that you're worried about, can take away a lot of that fear, because you're like, all right, I know if that happens, we'll be fine. We have a plan. And it's also important to know that it's more rare for a baby to have a bowel movement in the womb before around week 41 of gestation. A lot of times it happens closer to like 42 weeks, but it certainly can happen earlier. Some of the births that I've been at where this was an issue, they were around 40 weeks. So it can happen, during the end of the pregnancy. But again, it's more likely the further away you get from the due date. But again, know that a lot of times it is not an emergency situation. But of course, if you're at home and you think that you see meconium, it is important to let your care provider know as soon as possible, just so they can help to guide you and make sure that you and the baby are good. All right, if you have any questions about this or anything else about pregnancy, childbirth, or early motherhood, let me know in the comments below.